All right. Well, good afternoon, everyone. Thanks for taking time to hop on the update call with us today. Hope everyone had a Merry Christmas and getting ready for a Happy New Year. Um, just like before, we'll go ahead and start with sharing some of the data. I believe Jordan is on. At least I'm hoping Jordan's on, and can share the data update. And then we'll talk a little bit on our vaccination efforts. And then, assuming Brett might want to weigh in with a little bit of planning related to vaccination and where we're going and how we're moving forward. So, and then we'll answer any questions that people may have. So, Jordan, are you on?
Yep, I'm here.
Okay. You want to go ahead and start then with the data?
Sure. I will share my screen with the all county data so you can look at that while I'm talking. Just to mention, the tests weekly trend column was back this week, so I expect we will keep seeing that. And all of our counties remain in risk level E besides Kalkaska, which has moved down to risk level D. And the daily cases per million and percent positivity both continue to decrease for the jurisdiction overall. So yesterday we reported 203 new cases from Wednesday at 3:01 p.m. until yesterday at 3 p.m. There were 353 new cases over the past week of Tuesday to Monday, and the week before that there were 487. So we have seen a 27.5% decrease in cases in the past week. The total number of jurisdiction-wide cases as of yesterday was 9,201. Over that time period, cases were identified from school exposures, including students recently home from college, household exposures, care facility workers and residents, healthcare workers, those in attendance of social gatherings and religious services, some recent travel and pre-surgical testing, community contacts, and other worksite exposures. The cases by county as of yesterday are Crawford with 429, Kalkaska 453, Lake 287, Manistee 562, Mason 898, Mecosta 1,562, and Ferris Dashboard reported 527 cases as of December 23rd. So I don't think we will expect an update from them for the next couple of weeks. Misaki 409, Newaygo 2,135, Oceana 1,535, and Wexford 931. In the past week, there were 19 deaths reported, including some that came from the state as part of a vital records review, and 1,114 people have recovered. Yesterday, there were 5 positive inpatient cases at Munson Health Cadillac, 6 at Munson Grayling, 0 at Munson Manistee, 6 at Spectrum Health Big Rapids, 2 at Spectrum Health Gerber Memorial, and 8 at Spectrum Health Ludington. And I will send the spreadsheet over to Brett as usual so he can get it out to all of you.
Okay, thanks, Jordan. Any questions for Jordan on the data? Okay, as Jordan did indicate, we do continue to see a decrease in the number of positive cases, both cases per million and the positivity rate slowly starting to go down, which is good. Two of the metrics that we're watching, the other metric deals with the hospitalization, COVID patients hospitalized, and those numbers also are on the downside. So, hoping to see that continue as we move forward. The other piece, obviously, that we're working on, and well, I guess Brett, do you want to talk a little bit about vaccination and some of the planning, and then I'll kind of finish up?
Sure. So a couple things to cover with you is that right now we're receiving about 1,000 doses per week total for our 10 county jurisdiction. So as you can imagine, if you do the math, that's not very much per county. So what we've been doing right now is we are just running one clinic per week, and those are just at our offices. And we are doing the best to our ability of following the phases to do that. So we started with EMS and medical first responders. That was this week at our clinic. So we had one clinic per county for EMS and MFRs this week. So that was our last order of Moderna. We just got an order that we're going to use next week, and that's of Pfizer, and that was the same thing. We got 1,000 doses of that, and we're expecting that the next week we'll get 1,000 doses then too. So for at least the next couple weeks, we're looking at 100 doses per county on average. One point I wanted to bring up, because I have had a couple calls on this related to people getting vaccinated who are not part of 1A. And just so you're all aware, how we handled this is when we're doing a clinic with vaccine, they come in vials. And when we get down to I'm going to just pick a number. I'm going to say there are 50 people in the clinic. If we have 2 no-shows, that means we have 2 shots left that aren't going to be used. And in this vaccine, they can only be out for 6 hours. So from the start of the clinic to the end, if it's 6 hours or more, we would have to throw it away. So what we did, because this is, all kind of happening real quick, trying to get people in, what we did is we just made some calls to some people we thought we could get in to get those last 2 shots or the last 3 shots in a particular county. And in the example I'm thinking of, in one case, we called law enforcement. And I had some concerns voiced to me that why are we doing law enforcement who's in 1B when we have other not done in 1A. So I just wanted to throw out there that that's how we did that this week. To try to avoid that going forward, what we're going to do in our system is we're going to schedule appointments for vaccinations, again, based on the priority phases. And we're going to have a clinic scheduled next week and a clinic scheduled the week after that and a clinic scheduled the week after that. And what we're going to do is on this next week's clinic, if we have 3 shots left, we're going to call people. We're just going to start down the list of the people who are signed up for the following week's clinic. So they are in that phase. They are next in line. We're just going to go down the list and get 3 of them to come in and use up those shots so we don't have to waste them. So just wanted to throw that out there, that for those of you who are concerned about how that worked this week, we think we have a fix, so that won't be an issue in the future. So, and I don't know if I mentioned, but this week was EMS and MFRs. Next week, we're focusing on adult foster cares because I think we've mentioned on this call that the state has worked with CVS and Walgreens to do most long-term cares and most AFCs, which are adult foster cares. But there are some, for whatever reason, that either fell through the crack or didn't want CVS to do them. As an example, they wanted the health department to come in and do it. So there are some of those that we are going to catch up because they are next in line. So that's our plan for next week, the 100 or so doses we'll have per county for next week. And then after that, we'll be into phase 3. So phase 1, group 3, which is basically medical care providers. So anybody related to healthcare is then going to be, we're going to start opening up appointments for that. So that's kind of how we're going to move through this process. And then 1B is all essential workers, and a change. I can't remember if it was made before our last call or after. So in case this wasn't mentioned, 1B now includes 75-year-olds or older. So we'll be including them in that 1B essential worker group. So I think that's all I have, Kevin.
Okay, thanks, Brett. And that change was made after our call. So the prioritization guidance has been modified or changed a little bit, and so we will be obviously following that guidance. So as Brett said, we're finishing up EMS this week. Next week will be our AFCs and a little bit of homes for aged that we have. And then the following week, we'll be moving back into the healthcare provider groups. And so we'll be reaching out to those individuals to let them know when they can, when they're going to be able to get signed up for that. Again, as Brett indicated, we're dealing with not a large amount of vaccine, about 100 doses per county, and we believe we're going to have that at least through the 17th of January. At that point, it's estimated that we'll be, then the long-term care facilities that are taking up the Moderna vaccine will initially be done, and we'll be able then to also not only use Pfizer vaccine, but also Moderna vaccine at that point. So that should enable us to increase our immunization capacity within the jurisdiction. So it's going to, it's going to be slow as we start off, but we will, and probably take maybe a little bit longer, but we will get to we'll get to everyone eventually. We did start vaccinating last week. We did our staff who were going to be involved in clinics. We did about 80 of our staff, and then we also worked with the Manistee County Medical Care. And so between our staff and the medical care, our staff were 80, and we did about 128 individuals, both residents and or patients and staff at the medical care. And then yesterday, we ran clinics for EMS in Oceana County, where we did 30 individuals, Mason County, where we did 60 individuals, Massaukee, where we did 40, and Mecosta, where the number I have is 70. And so I don't have, today we're doing clinics in Newaygo, Kalkaska, Lake, and Manistee, and I don't have numbers for those yet. And then tomorrow we have clinics in Crawford and in Wexford. And so we'll share those numbers as those become available. So the immunization piece is taking up, obviously, as you can imagine, a larger amount of our time. Even though the vaccine amount may not seem like a lot, there is quite a bit of logistical work that goes into getting our clinic scheduled, because it's not just one clinic, but it's also 2 clinics, so that we're following up. So I don't know if people have questions on any of that. We can go ahead and start asking those, Brett, or answering them, Brett.
Okay. And in fact, the first 4 all have to do with how their group's going to be notified.
Okay. Do you want to, from a planning perspective, what we had talked about?
Sure. So I think for the most part, it's going to be depending on what group we're talking about. So we got a couple road commissions and non-hospital based medical providers are the questions. So depending on which phase you're in, I'm going to use doctor's office and dentists, because they're going to be in that phase 1 medical care provider group. So what we're working on is a survey that we're sending out and or phone calls to those organizations. So we have staff who are checking lists that we have, and then checking state lists and trying to make sure that we can notify everyone that's supposed to be notified. And then we are just going to make those notifications. So the long story short is we will work with your individual company, provider group, business, to just let you know that, okay, we're down to phase 1B, so you guys can make an appointment. And I think that's all. Those were the only 4 chat questions. So anything on the phone, any question on the phone that we can answer right now?
Hey, Brett.
Yes.
Quick question. I think you might have talked about this in one of the prior phone calls, and I think you gave your personal opinion to it, but what about admin staff for all of our different agencies, depending upon if we're 1B or whatever, but our administrative assistants, the ones that are here working with us, are they going to be able to be included within that, or are they going to have to be later on?
Yeah, I'll give you the 2 theories behind that, and then I'll let you, Kevin, give you the health department answer. But so the 2 thoughts are, one is because we have limited vaccine, I'm going to use a dentist office as an example. So if we have limited vaccine, meaning we only have enough to actually do the dentists, we wouldn't have enough to do the receptionists up front. One one train of thought is then we just need to do dentists. We can't do the rest of the practice. The other train of thought is, well, if we just do the dentist and then there's no support staff to assist them, then they might not be able to operate. So both of those are valid points and difficult decisions, but I'll turn it over to Kevin for him to give you what we decided on doing.
So, I mean, we will try to stick to the prioritization as best we can, but there may be situations where, just simply because we have extra vaccine, we're going to do, we'll do everybody there in that office just to get them done. Again, I think some of that is going to be based on, okay, if not doing someone going to interfere with the operation or the patient care or the services that are being provided. If that's the case, then we're going to go ahead and vaccinate them. If there truly is somebody that has no patient interaction at all, and again, because we have limited vaccine, that would probably be somebody that we would say, can we hold that person off so that we can focus in on truly that priority. Does that make sense?
Affirmative. I appreciate it.
Okay.
Any other questions from the phones?
I guess one more question.
Sure.
And this might have been discussed before, and I apologize. It's repetitive. What about the person that just came off of being either a positive, and then for the vaccination, there's been talk about that. They can come right in and get the first round of vaccination, even though they just were positive or came back to work, 5-10 days ago, if that makes sense.
According to the guidance, as long as they are not acutely sick, they are eligible to take the vaccine. Now, again, having said that, if we're dealing with with a limited amount of vaccine, and we have others who have not been positive in the past, and being positive does give you that little bit of immunity. I'm not sure for how long it is. We may advise that individual may wait, if they can wait for a bit, and we focus in on those people that have not been positive, that are in that higher prioritization group. But there's nothing, as long as they're not acutely ill, they would be eligible for the vaccine.
Okay. And what has there been for a timeline for that quote antibody or that resistance to it? I know it's wavered between 60 days, 30 days, 90 days. Is there anything? What is the guideline?
It's still wavering. It's still wavering. That same time frame. There is no absolute. And I think that'll be one of the pieces that will get studied as we learn more about this.
Okay, appreciate it, Kevin.
All right, Kevin, we got a chat question. It says, I have two older couples that are positive. Both sets are having great difficulties. One couple is getting regular calls checking in from the health department. The other has heard nothing. What contacts are you trying to do? And did the second couple fall through a crack?
I guess I'd have to know the names of the second couple, so we can go back in and check to see if an attempt was made to contact them, if it was our staff that attempted to contact them, or possibly some of the state helpers that are working with us on that. So if you're willing to share the name of that couple, first and last name, we can go in and check and kind of see what the case history says.
And Brian, obviously don't do that here, but just send Kevin an email with that information if you want to share it.
I will do that. Thank you.
Okay.
All right, I think that's all we have, Kevin.
Okay. Anything else? Again, as I said, because we're working with a limited amount of vaccine, it is going to be slow going for a little bit until we can get back to where we're getting a larger volume not only the Pfizer vaccine, but also the Moderna vaccine for us to use. So I know everyone would like to see this whole process move a lot quicker, but we have, we only have so much that we can use and need to try to follow the guidance as best we can. So we will be reaching out, as Brett said, to those groups as we move down that priority list, and as we find ourselves available to to do vaccinations, we'll reach out to those groups. And again, there may be situations where individuals not necessarily in the current priority group that we're doing, where they may have an opportunity to get vaccinated only because we have vaccine available and we don't want to waste it, and they're able to come in. So,
Kevin, another question real quick.
Sure.
Go ahead.
You get the first vaccination, now you get a close contact. Same thing, quarantine until you get the second dose. I'm sorry if this is a simple question.
Yep. No. You would still need to get the second dose. Yes, and quarantine would still be required.
Okay.
Okay,
Chat question, Kevin. It says, is the health department strictly administering the vaccines, or are facilities going to give them to our own staff?
The health department and the hospitals right now are the facilities that have been identified to provide vaccinations. I know there also is an effort to get the FQHCs signed up to be a provider of vaccines. That the FQHCs are actually was on a call at I think it was on the 2 o'clock call, where they indicated that they really are trying to get all of the FQHC's paperwork in order so that they also can be a provider if they're not signed up yet for vaccines. And then they're going to move on to the individual provider offices who have submitted paperwork to be a provider of this vaccine. So there is a sign-up process that that practices had to go through to be able to provide, to store and receive, store, and provide this vaccine. And so the state is trying to work through that. We have no control over how that happens. That's all being handled down in Lansing by the state immunization program. So, but what they did share at 2 o'clock was that FQHCs are that next group in line that they're trying to get situated so that they are all good to go if they haven't already completed that sign-up process, and then they'll be moving on to the individual provider offices.
And I can add, just for your information, there are 3,000 applications in the state queue right now from providers asking to have permission to give vaccine. So like Kevin's talking about, it's going to be a while just for them to get through the paperwork. And then the second thing is, because of the limited doses right now, even if a provider was through the paperwork process, they aren't giving any out to local providers. Like Kevin said, it's just health department and hospital at this point, because we're using up all the vaccine that's available. All right, Kevin, another question. If you get both vaccine doses, will employees still need to quarantine?
My understanding is well, let me clarify that. I think that's still one of those points that the latest guidance that I'm seeing is still yes. But having said that, I do need to go back and clarify if that is still the guidance that is being provided. So we'll get an answer to that question, and I want to be sure to give the accurate information. So I don't want to say something that may not be true. So we'll get an answer to that one and provide that out to the group as an update email.
All right, any other questions on the phone? And that was the last one in the chat box, Kevin.
Okay. if there's nothing else, again, if you want to share that information on that couple, just send an email to me. I can look into that. I will get an answer on the quarantine question related to following a completed vaccination series. And then, as Brett indicated, as we move down that priority list, we will be reaching out to the various groups to get them to let you know that it's okay to get to start calling for appointments. And then as we move down, and Brett, I think this is what we had talked about, as we move down that priority list, then everyone who would have been above that may not have been vaccinated would also be eligible to come into those clinics moving forward, correct?
Correct.
So it's not kind of a one and done, and if you missed it, you missed it. You will have other opportunities, but it will be down the road a bit. Okay. Assuming we're going to go ahead and meet again next week, Tuesday, at 3 o'clock. Again, we'll hopefully get information to you in advance of that related to the question. And if for some reason we need to pull the group together before that, we'll go ahead and do that. Otherwise, if there's no other questions, guys, thanks for taking time to hop on the call with us today. And everybody have a happy new year and stay safe. Thank you.
Thanks, Kevin.